Hello, everyone. In this episode, I have another day in the clinic with me. The past episodes of me being in the clinic and sharing what I find have been really popular. So when I find a good day of sessions that I'd like to share them all with you, I put them into a podcast. So listen in as I talk about 6 cases that I worked with and what I found and did to support my clients. And if you want to learn more about how I do what I do, join me for the first Holistic Treatment of the Postpartum Body online cohort that starts on September 30th. Sign up today. Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started. Hello, everybody. Welcome to this episode. Today, I'd like to share a day in the clinic with me. I had some interesting patients today that I'd like to share with you. But before I do that, I just want to remind you that the doors are open for the first cohort of our treating the holistic treatment of the postpartum body course. And that will be starting September 30th. And it will give you a more supportive journey of doing the online course with 4 group calls with me and weekly emails to encourage you to get through the material that is planned and scheduled for you, to help you to chunk it down into bite-sized chunks so that you can stick with getting through the material each week. I think the average is less. We try to keep it to under an hour of material each week as you go through it. It's almost an 7.5 week course that will take you through November. And then I do a welcome call, a 1-month group call, an end of the cohort group call, and then we do 1 month after as well, just to see how it's integrating into your practice. And if you have any questions of using the material a month after the course is over. So if you have purchased the online course and have not started it or completed it, you can join the cohort for free. Please just email us at support@instituteforbirthhealing.com and we will add you to the cohort. So my goal is to just make sure that you are getting this material into your hands and that you're using this material effectively and getting good results in your clinic. That is my joy and what I want to share with you all. So thank you so much for those of you that have purchased it. And for those of you interested in joining the cohort, it's going to be a lot of fun. I love these cohorts and the opportunity that I get to connect with you on those calls and answer your questions and things. So please check that out. It is on our website and it'll also be in the show notes here. So let me dive into my clinic day. I actually have one client, and I'll share this one first. So this is actually from another day, but I just found it so fascinating. And this gal, not pregnant, not postpartum, but she had a osteotomy put in because she had really bad IBS and Crohn's disease. And so they took out her large intestines, and she has this ostomy that our stoma put in, and it had to be revised several times. And so there's just a ton of scar tissue and pulling around that stoma. So that's the opening. It's the connection. There's a pouch now where her small intestines dump into this pouch. She no longer has a large intestine. And they tried to keep a part of her rectum, I think maybe possibly to reconnect it, but they had to take it out and they actually had to close up her anus. So she calls it a Barbie doll butt. But she's having a lot of tension in her perineum area. And so when I went to evaluate her, I was drawn in general listening down to the right side, and that's where her stoma was and the ostomy is. And she, but as I was tuning into her pelvis, her pelvis was rotating like up towards that pouch. And when I was listening energetically to the tissues as I put my hand in the midline, and this is something that I teach in the postpartum course, there was a pulling up to the stoma. So, all the tissues, the pelvis, everything was rotating and being pulled because of all the scar tissue that had occurred from those multiple surgeries that she had. And I just felt that found that that was so interesting that when I was local listening, that the tissues were just drawing me right on up to that area. And then she was super hard. Her entire belly was just solid. There was no mushiness to her abdomen. And so I just worked on trying to release some of that tension in the abdomen, and especially around that opening, just releasing all the tension so that that whole area could move more freely. And she was amazed at how different she felt after the session, that like her belly could move freely. I also did intravaginal work with her and found that the internally, that there was a lot of, again, pulling up and almost internally, like up to the right side, again, into that stoma area. Vaginally, those tissues were also being drawn up there. And I released that and then worked a lot on the anus, which no longer has that sphincter muscle, but there was a lot of scar tissue in there. And I worked a lot on the IRF, so the ischial fossa area in there and all that tissue, and just kind of helped release it. And then also remember, because of that connection of the sphincter muscle and the raphe connecting it to the tailbone, as I was working all that, I had my outside hand on the tailbone, and it really helped to soften everything. And when she got up off the table, she was just like, oh, and she could sit down without like being gingerly about it. Like her tissues just like softened and were able to relax with the sitting, whereas they weren't doing that before. So she felt completely different. And to me, what hammered home the most for that session was the ability to listen into, what do the tissues want to do? Where are the tissues pulling me? Where are they being pulled? And it was almost in an energetic way that they were being pulled up into her ostomy and her stoma there. So, so interesting. Okay, so that was that one client. And then I also had I had a new patient that I evaluated today. And this person, she's a body worker, and she's seen a ton of chiropractors and PTs. And she came in, she's like, my pelvis tends to rotate anteriorly on the left. And she had a lot of left sacroiliac joint dysfunction and pain during her pregnancy. Oh gosh, I forget how old her baby is. I forgot to ask that, but it's been a while. I want to say 7 or 10 or somewhere in there. When she had labor, she said she just felt like her hips were just, there was so much tension in her hips as that baby was trying to move through, that the pelvis did have an issue opening. However, her entire labor was 12 hours long, and the pushing was super fast, and she was doing it in a standing squatted position. She did tear. And she also said that she passed out twice afterwards. And the midwife, she did a home birth, and the midwife they weren't sure what was causing her to just black out. And interesting, I'll tell you my theory on that during the session, what came up. But so she passed out twice, but then it went away and she was fine. She didn't have to transfer anything. She also, um, told me about she also said that she had a rectocele going on that was not from birth. It was prior to that. She had a fall with an injury to her perineum that caused her to have a hematoma on her right side. And so I was curious about that. I was curious about what I was going to find about that. That had happened years prior as well. But she had a little bit of pain with her periods. And so when I went to assess her in standing, I did a general listening with my hand on the top of the head. Again, I teach this in the postpartum course. There was a slight twist, and it felt like it stayed up in the head. And, she also told me, as I was listening to her body, that she had had a bike accident where she was in college and she got hit by another bike, and she said she didn't realize that she had lost consciousness until she got home, and then she didn't really remember the crash or the accident, and so there most likely was a loss of consciousness, just slightly, and she didn't really say much more other than that. So she had so as I was tuning into her body, her shoulders just kind of felt almost frozen a little bit, and it just felt like there was tension in her head. So I knew I needed to address her head. And when I went to then I laid her down on her back, and um I was immediately drawn to her head. So I started working on her cranium and releasing the twisting and everything that I was finding in there. And then I went to a dural tube hold release and was really noticing that the right side of her cranium, where like things were twisting to the right in her head, but it was really connected to the left side of her sacrum. And so I released that, and my sense was that this was from the bike accident, and that the left side of her pelvis kind of got injured, or, somehow impacted, during that bike accident. And then, as I was working on that connection between the two, total just a sense of knowingness, but yet I have no idea. But I did kind of share with her, I go, I wonder if the passing out after your births was related to the loss of consciousness from this bike accident. Like the birth re-triggered the trauma from that bike accident. That was kind of my like little hit that came to me as I was working on her. So we don't know, but she was like, oh, that does seem correct. Because there was zero reason why she passed out twice after her birth. Okay, so then when I checked in with her sacrum, I felt the right side of her sacrum was jammed up and it had decreased mobility. And as soon as I started palpating her sacrum mobility in her SI joints, I noticed that she moved equally both sides, but the right side was a little bit more restricted. And I asked her, I said, are you hypermobile? And she said, yes, I am. So that, for those of you that have studied with me, know that I teach that I needed to really pay attention to the end range spring testing that I teach. And right side was definitely different than left side. So I released that right side, but there was a lot of jamming up on that right side that I didn't recognize initially as I was just mobilizing that sacrum, not until I did internal work. So I released the sacrum as best I could externally. And then I decided that it was time to do some intravaginal work. And, externally, I also felt the right coccygeus muscle area was a lot tighter than the left. And there was just like this inability of that right side to come down externally. So I brought that curiosity to intravaginal work. And what I noticed about her opening of her labia was that the right side, down low where the labia minora come in and the majora, the right side was actually pulled up and kept the opening open. So it was just right down at the bottom near the perineum. The right side was kind of pulled up and open. So I knew that there was some scar tissue in there that was kind of creating that opening of her labial tissue from that hematoma that she experienced. So then going internally, her definitely right side coccygeus muscle, they actually weren't that bad as far as, there was some tone and some springiness of the muscles. However, what I really noticed was that the left side, and I teach this again in the postpartum course, the left side had this beautiful flow as I tapped into those tissues, the pelvic floor muscles and flowing out towards the opening, but the right side had none, 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 none. And she also said something about like feeling numb or just like kind of disconnected to that area. So we did a trauma release statement for that right side about the bike accident and the falls. And that really helped that right side to connect. The other thing that I noticed is that as I was trying to get that right side to come down, what really needed to happen was I put some pressure on that sacrum and encouraged it into its upward mobility. So the right side of the sacrum wanted to go up towards the head, and encouraging that allowed it to soften and then release. And then I was better able to help bring those pelvic floor muscle tissues anteriorly towards the pubic bone, towards the opening. And that released the trauma, helping to release the trauma, helped it to another level. And she just felt really more reconnected into that right side of her pelvic floor at the end of the session. She had a much better contraction of both sides afterwards. Um, oh, the other thing I found was that her cervix was way anterior, poking into her bladder, but she didn't complain of any bladder frequency, urgency, or anything like that. But after the release of the sacrum coming down and those pelvic floor muscles coming forward, the cervix just went boop and dropped straight down into the middle. It was so cool. And so when she got up off of the table and she was standing, she's like, whoa, I feel way different from side to side. It just felt really, really different. But the biggest thing she noticed is when she sat, she was able to sit evenly on both ischiums and just was solid. She goes, I don't sit like this normally. She's usually off to one side or, does something weird, but she was just like, wow, this feels so comfortable to just sit evenly side to side. So that was so, so cool. So that was my first patient of the day. And let me review what I did with my second patient, because that was also, so my second patient of the day, this was my second time I saw her. I saw her back in July and now it is September. And she had a hysterectomy back in 2019 because she had a huge fibroid on the outside of her uterus that was creating back pain for her, and also sometimes having leakage of her bladder with urgency. Um, uh, she also is in menopause, obviously. Um, she had one C-section, one vaginal birth, and she felt like the VBAC really traumatized her, and she ripped open with that one. She's also complaining of left side hip flexor pain, and she also had a hairline fracture in her right elbow. And the first session, I just worked on the pelvis a little bit, trying to just kind of close up the bones from the open birthing pattern, and then just helping the tissues to find their happy space internally, releasing the bladder, and getting the pelvic floor muscles to relax, release any of the scar tissue in there. And then so when I saw her today for the second time, she's still complaining of some low back pain, and she said that her wanting to pee was way less, so her urgency had gone down. But she was still complaining a lot about this left-sided hip nerve pain, kind of wrapping around the ASIS, and the pain was from like PSIS to ASIS, so that lateral whole iliac crest. She's like, it wraps around, and she goes, I can't lay on it at night. It really creates a lot of pain. It's not all the time. It kind of comes and goes. She goes, I may need to get an MRI or something. I just don't know. She goes, I don't know if it's from I carry all my grandkids on that side. I carry heavy things on that side. And she complained that it's a dull ache that wraps around, and then there's nerve pain along with it too. So in standing, when I went to assess her, general listening brought me down to that left side, left pelvic area. And then as I put my hands on the ilium on either side from behind. And as my fingers felt into around the ASISs, I noticed a huge difference from the left side to the right side. Like the left from ASIS back and around just felt really hard. And I was just like, huh. And she also said one of the things that I talk about in my courses, mainly, well, both courses, pregnancy and postpartum course, is that The laying on the left side. I hope those of you that have studied with me know exactly what I went to do first, which technique that I teach. But I did have her lay supine, and I just kind of tuned in and checked in. And her left, so springing her left ilium, the ASIS, springing it posterior, was a little stiffer than the right. And again, it was just super hard, that bone. So I immediately got her into right side lying, and I did the in flare, out flare correction that I teach. And this one was, I had to use all three of the different techniques that I teach for correcting that. She needed all of them. And then I got her back into supine and just kind of rebalanced the PSISs and the ischiums. And then I went back to that iliac crest, and it still had a little bit of hardness in the bone itself. And so I just kind of started working on it. And then she says, and she didn't mention this in her intake, the first session, but when she was 12 years old, she fell off a horse and she fractured her left knee. And so as I'm working on this IL or the ASIS and iliac crest on the left, she says that, and I put my hand right at the tibial plateau on her left, and it was more medially that was fractured. And it was like there's a massive connection between the two, my two hands. So as soon as I started tuning into the tibia, the the iliac crest started softening. And so I talk about connections in the advanced postpartum online techniques course. And this was definitely a connection between her tibial fracture and the iliac crest and the ASIS. And so that really helped it to release. And then I just did a lot more work, like her whole knee, patella, and she was even complaining of ankle issues, just tightness in the ankle. And I just worked with the bone and started softening all of that area. And even the femur on that left side, the entire left leg was just hard. The bones were hard. Mainly, the biggest spot was where she had the fracture, obviously. And we worked on, let's see. Yeah, she just had no energy flow going down that leg at all. And I'm not sure we did any limiting beliefs or any kind of trauma release. We may have, I think we did do a trauma release statement with the knee and the hip, about letting go of that and helping that 12-year-old to know that she made it, she survived it. And then her left leg felt totally different after that. She was just like, and then I had to work on the right leg, because the right leg had been doing was just felt firm. And like the right leg had been doing way more work. And I could tell that when I lifted both legs up and was holding them and rotating them, the right leg just felt like it had been doing all the work her whole life. So help that to soften and just try to bring more balance into her pelvic space and into her legs, internally. So then I did do some intravaginal work, and her bilateral coccygeus muscles were tight, which, I didn't address the whole pelvis. I did that the first session, but what I missed this time, or I just wasn't aware of until I went internally, was that her sacrum was still stuck in flexion. So the bilateral coccygeus, they felt like cardboard. They were not wanting to release. There was no mushiness to those tissues, and it was bilaterally. So I knew that it was in sacral flexion. So I brought the sacrum anteriorly, and that helped the muscles to release a little bit. But the right side was definitely harder. She did have a hysterectomy scar, but it wasn't too bad. And releasing that sacrum and that right side, and that really softened the tissues. And then there was better flow coming out of the pelvic floor muscles, flow going down her legs. And she felt so different after this session. So that was a really, really fun one, and kind of shares a little bit about the connections that I teach in the advanced course, some of the techniques I teach in the postpartum course. So you guys, I'm teaching you what I do every day in the clinic. So let's talk about the next client here. So my next client was someone I've been seeing for a while, and she had had bunion surgery many years ago and still had the hardware in there. They had done I forget, it was over the instep of her foot. They didn't do the surgery right at the MTP joint, the distal joint. It was more in her forefoot. And so she had the hardware removed recently, and she had really good range of motion. Her bones felt good, but little scar tissue. And so I worked on releasing that. But she's also had bladder issues that we've been also helping her out with. And after I got done releasing the scar tissue from her surgery in the forefoot, I was noticing as I just put my hands on her pelvis that the energy of her right leg was just flowing straight down her leg, but the left leg was actually kind of going laterally and then down. So it wasn't coming down the midline of her legs, but it was on the left. It was kind of bypassing and going laterally and then down. And so I'm like, huh, I wonder if that's from maybe having to be more on the right side or the lateral side of her foot as this has been healing, possibly from her walking. And so I just worked and tried to help get that energy flowing down the midline of her leg, which actually I'm not 100% sure on this, but my instinct or intuition was saying that that might be the bladder meridian. And as I was working on her, I just got the hit that she should work with an acupuncturist to help encourage that meridian flow for the bladder. And so we just worked on that. And then I'm trying to think. Oh, there was a lot of fear coming up for her, and we did some trauma release work, but not we didn't dive into it too much. Um, because she just kinda she had another way of working with it. She was gonna take something else and was gonna do something else, and I just had a sense that she was supposed to work with that with the acupuncturist and what she had planned on doing, so I didn't dive too far into it, but it was just really cool to feel that kind of bypassing that midline flow going down the leg and then working on trying to encourage that more, and feeling a difference and a shift in it. And then getting a sense that, like, okay, this is someone that she needs to go work with and help support her there. So that was it. Then my next client today is only 14 weeks pregnant. I've been seeing her monthly for a long time. She's now pregnant, and it's going to be so fun to support her throughout her pregnancy. She had no intention, she had no aches and pains. She was like, it just feels good to be supported and being held by the feminine." I'm like, "Okay, that's my job today." So I just did, and she loves hour-and-a-half sessions. So I work with her for an hour and a half, and I did a ton of craniosacral therapy with her today. I did notice with her legs, there was a slight rotation. The right side was lifting up. The right leg just didn't felt a little bit heavier than the other. And so I was thinking that there was a little bit of twerking or something maybe going on with the uterus in there. But at 14 weeks, I want to do things more energetically, just be really careful with the pregnancy. And so a lot of cranial work, a lot of dural tube work with her. And then I did do some just holding uterus to sacrum, and I felt some beautiful releasing, like right side uterosacral ligament felt like it really softened. And then when I was doing PSIS as an ischial tubes, when I compressed ischial tuberosities, she was noticing some pain in her pubic symphysis. So I worked and focused on a little bit more with that and noticed that her left side pubic bone was a little bit harder than the right side. So I've added a little bit more attention and focus to that. And then I got a sense, I had her bend her knees up and I did the lower abdominal fascia release. And I was surprised at how tense her broad ligaments were. And so we did some gentle release work in there and just, very, very gentle, more energetically, just tried to see if we couldn't soften that so that her uterus could be held in there with more ease and grace and not so much tension in there. So that was that session. And then my last client of the day was someone that I've seen for a couple of sessions, and had she's having pain with intercourse, and she's never been pregnant before, and she's had a lot of trauma that she's experienced in her upbringing. And let's see, I've seen her a couple of times. This is probably my fourth time seeing her, and she is very in tuned with herself and everything going on. And she has done a lot of traveling this summer. So I last saw her in May, and we were doing some intravaginal work, and I encouraged her to do some self-exploration and massage of her vaginal opening, because there's just a lot of tension and tightness of the introitus, and she's having insertional pain with penetration. So this time she was like, I have a lot of fear of abandonment has been coming up for her as she's traveling. And she went home and stayed with her mom for a little bit. And she did say that when she was born, her mom had to leave her in the ICU and go home, and she was left in this incubator by herself. And she's like, and she said there was another time where her aunt, she was sleeping and her aunt just went down the street a couple of houses down, and she woke up and was like panicked because nobody was there. And so this fear of abandonment really brought a lot of reaction to her. And I'm like, oh, well, look at that fear of abandonment, that not feeling safe, that's pelvic floor muscle tension, obviously, too. So, and she recognized that, and she was able to do some self-exploration, touch her cervix. She said that was really cool. And she was able to have intercourse with her boyfriend without pain. So we're getting there. But she knew this abandonment issue was really coming up. So this session was definitely um, more on the energetic, emotional trauma release from her body. So things that I teach in the Birth Healing Intensive program. And I really got drawn to her pelvis and just holding that. And she we dove right in. I only had a half hour with her, so I didn't have a lot of time. So I dove right into her feeling that abandonment. Where do you feel that in your body? And just the tension in the chest. And so I started asking her, well, get curious about that. What do you sense about that? And she goes, well, I feel like, oh, how did she say it? I never remember the words. I wish I could just record every single session, but basically it came down to that she felt like, oh, I know. She goes, every time I feel like I just want to go home. And I go, home to mom and dad home, or home to God home? And she's like, oh, home to God. And so I'm like, well, that's the fear of dying. And she's like, oh yeah. And she felt that in her body. And so we did, I'm gonna die if, let's see, I think we started out saying I'm going to die, and then I got a sense that it was abandonment equals death. And so we shifted that limiting belief. And then we also, um, oh, the other thing that we did was that she really, because the baby was abandoned at birth, we replayed that and brought mom to her and brought in the great mother energy to kind of help support the two of them. And she just had this, like, there was this huge softening in her pelvis. And I was like, so what's coming up for you? And she's like, it's the first time that I feel held and congruent with my mom and not fractured. She said the word fractured. And so there was this healing of them coming together. But what happened after we healed all that abandonment and fear of dying and things is that the baby was still stuck in that incubator. It didn't realize that she was here today. So I had her go back to envisioning herself as that baby in the incubator, and then having her adult self coming to that baby and picking her up and holding her, and having the great mother energy holding the two of them as well. And that really helped. Again, another level of softening. And then I asked her to tune in what else was going on, and she said what came up for her was when her mom told her that she hated her. And so I'm like, well, where do you feel that in your body? And she goes, across her chest. And so I'm like, okay, let's, tune into that, and let's feel that, and let's bring your angels and guides in and see if there is any insight that you need to help understand what was happening at that moment in time for your mom. And she just kind of, like, some tears came down, and she's like, oh, I hadn't realized that my mom's, I forget what it was, but anger and grief or something was, that's why her mom yelled that at her, because her mom was going through her own stuff, and she was holding mom's stuff that she threw at her. And so that, recognizing, oh, this is mom's and I can give it away, I can let it go. She felt a lot of opening and more flow and connection to her core in her body. So that is, yeah, didn't do any intravaginal work. But the other thing that happened was when I did internal work the first time, or one of the times, her cervix is way off to the right and really held over against that right vaginal wall. And I felt like I had my hands external today. And when we were doing that fear of abandonment, or when she reconnected to mom, that's what it was. So when she was born, we re-envisioned mom staying with her the whole time. And that I just felt this like thunk. And I'm like, my sense is that her cervix shifted back to midline because the cervix was avoiding the left side, avoiding mom. And so I'll be curious next time I see her if I'll find the cervix in the midline. So I made a note of that. So I'll check that out next time. But she felt it as well when that happened. So such a cool session. She felt so different. And again, all that happened in a half hour. Isn't that amazing? So that is a day in the life in the clinic with me today. And I hope you found that helpful. Hope you were able to learn something from that. And I would so love, if you haven't taken any of my courses, I would love for you to get this type of work into your hands so that you can have these same amazing connections and results with your clients, because it's just, the body's amazing, and it's just wants us to be able to listen to it and respect it and know how to help it to let go. And that's really what this work is all about, in doing it in a respectful way that doesn't cause you to force something to happen that doesn't want to happen. When you get to the root cause of what's going on and you find the connections in the body and you get to the limiting beliefs that are being held in there, all of that just helps those tissues to melt beautifully underneath your hands. And I'm addicted to it. It is so fun to feel. It is so fun to have that connection. And, know that the holistic treatment of the postpartum body course is happening starting September 30th. So please sign up before then so that you can be a part of that cohort. I also am opening registration for the birth healing intensive that's going to be happening next year in January. It'll start the end of January. That registration and opening of the doors will happen in October, November. So be looking forward to that as well. All right, guys, thanks so much for listening in. Please share this with your other colleagues. Let them know about this podcast. I'd be so grateful. And here is to smoother births and faster recoveries. Take care, everybody. See you on the next episode. Bye-bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.